Troubled rollout, now a federal investigation into Maryland's beleaguered healthcare exchange. WJZ is live. DeMetrick is back from Capitol Hill, where the probe was launched. Alex?
Well, Vic, this may have been started by a Maryland congressman, but these investigators are independent of politics, and they are diggers. When the Affordable Care Act rolled out across the nation's computer screens, federal websites were plagued with errors. So was Maryland's state exchange site.
Now there's lots of unexpected bottlenecks and delays.
Even with $200 million in federal money poured into Maryland's exchange. The question now for some is
how $200 million federal dollars could have been frittered away in that exchange.
Maryland Congressman Andy Harris says his request for an investigation has been taken up by the Inspector General's office.
I'm not hearing about any state investigation, which is one of the reasons why I thought that the federal government may have to get involved.
Sure, anybody who wants to investigate it can investigate it.
But Governor O'Malley won't likely be the focus. Much of it could fall on Lieutenant Governor Anthony Brown, who was in charge of establishing the exchange. As problems about his leadership mounted, he also said questions need to be answered.
Where we need to look at, and whether you call it an investigation or an audit, to see what went wrong.
That won't be in Harris's hands. The Inspector General's office is independent, apolitical, and has seasoned investigators with subpoena power. But Harris has a wish list.
On how these contracts were let out, what the oversight was on performance of the contracts, and then whether or not the oversight was appropriate and ongoing in order to avoid the debacle that occurred.
Lieutenant Governor Brown's office would not comment on the investigation, although Governor O'Malley tells WJZ that the state's big mistake was in hiring the wrong contractors to establish the exchange. Vic?
Alex, thank you. Representative Harris is Maryland's only Republican in Congress and is a critic of Obamacare. According to Governor O'Malley, 200,000 Marylanders have enrolled in the program.
Well, a very